Good afternoon, everyone. We are live today at Sakra World Hospital, Bangalore. Today is 4th March and it is observed that 4th March is World Obesity Day, and we have with us our expert Dr. Manoj Kumar R to discuss about adult obesity causes and consequences. We welcome you, sir.
Hello everyone, and hello Amrit. Yes, World Obesity Day is celebrated on the observed on the 4th of March every year since 2015. Obesity is a word which has come into vogue in the last few years. Rightly so, because the average weight of the population all over the world has risen in the last 50 years. Like when you compare about 50 or 60 years ago, the percentage of obese people was about 2% or so. Now it's about 13%, which is staggeringly high. And to address this to commemorate this, World Obesity Day is observed. Obesity is not just an isolated problem. It is a conglomerate of various diseases such as diabetes, hypertension, and cardiac diseases, as well as stroke and various other diseases, including cancers. So it is not just a single entity, and it requires a thorough study and as well as treatment.
So, doctor, here are a few questions from our viewers. What is obesity and its causes?
Yeah, as I said, obesity is when a person is overweight beyond a certain normal limit. It is usually measured with the body mass index, which is actually the weight of a person with respect to his or her height. The more the weight is with respect to the height, then the more the BMI is. So that means the cutoff is about 25. So the BMI of 25 is, or under that, is considered normal. And if it is more than that, 25 to 30 is overweight, and more than 30 is obese. So once the body mass index increases to above 30, the chances of various diseases or various systems getting damaged, such as the heart, lungs, and the vascular system, are very high. So that is the reason why obesity needs to be tackled.
We have next question, that is, what should an obese person eat for breakfast?
Okay, right. It's not just an obese person that should eat a certain breakfast. It is for everyone. Number one, everybody needs to prevent themselves getting obese, and the people who are obese need to follow certain dietary guidelines to reduce their weight. So essentially, it's just a energy balance, the consumption of calories versus expenditure of the calories. So the more you consume, the more you need to spend it. So the especially in obese, when they have already, fat is actually a storehouse of energy. So it is necessary in times of need, such as famines and droughts, which are not at all common now. And so that's the reason why we are living in an age of plenty, right? There's nothing, you just go down the corner, then you can get chocolates, cakes, and whatnot, and you just binge on it, and then these are unnecessary calories. So this is number one, it has to be cut, especially the mornings, because mornings are the time where we need to eat a wholesome breakfast, which has to be rich in proteins as well as complex carbohydrates, not simple carbohydrates or sugars, complex carbohydrates, and as well as unrefined fats. So these, when consumed, even by obese or normal people, eventually will lead to a normalized weight.
Next question is, how can we reduce obesity naturally?
Obesity, of course, you need, number one, you need to have very high levels of motivation. Right, it's very easy to just, when you're with a group of friends or something, you just go and just binge on something, a pizza or any burger or something, all the junk food. It's very easy. These are junk calories which are completely not necessary. This is called recreational eating. So eating should not be a recreation. It is for nourishment mainly, and as well as for the upkeep of the body. right? So it should not be used for recreation. Chalo yaar, well, let's get we'll get ourselves a burger or something. No, that's not the thing which we should be doing. And every calorie needs to be accounted for. So number one, the motivation levels have to be high. And so with respect to that, yes, decrease in the consumption of calories, and as well as exercise, just normal light exercise like a walk, evening walk or a morning walk, just does not do the trick. What needs to be done is moderate exercise, at least for about 40 minutes. Only then this you will be able to burn enough calories, and as well as fire up your metabolism, so as to burn more and more calories during the day and all throughout the day. So these are the two basic tenets with which obesity may be reduced naturally.
Yeah, we have a next question. Can obesity be cured?
Yeah, of course. As I said, yeah, we have various natural methods, like definitely a good diet and an exercise. And these two, as I said, require high levels of motivation. And of course, there are some pharmacologic, or rather, the using tablets or medicines to come to curtail the appetite. But these have not shown a prolonged benefit. Maybe they will reduce the weight, they'll suppress the appetite for some time, but then after you stop the medication, there'll be a rebound gain in weight, and of course they will essentially get back to the normal weight. But of late, in the last couple of decades, the bariatric surgery or the weight loss surgery has been developed, which addresses the physiology, at the root cause of the obesity. That is increased appetite, increased cravings for food. All these will be curtailed with the use of bariatric surgery, and this has shown through research that it can provide significant and sustained weight loss.
Okay, we'll move on. Next question, that is, how can we prevent teenage obesity?
Yeah, that has become a problem actually. Recently, in a study from India, it was shown that about 10 out of 100 children are either overweight or obese. This is alarming because childhood obesity later on can lead to a lot of metabolic syndromes and various medical diseases, which can lead to a crippled life and also an early death. So to prevent this childhood obesity or teenage obesity, I think we can address this at various levels. At individual levels or family levels, it has to be a strict policy from the parents that yes, only certain foods are allowed at certain times. Right? There's no binging of snacking at unnatural times, and then especially the sugary sodas, juices. These have to be avoided because they are just empty calories. And in the family, definitely healthy habits such as regular exercise have to be encouraged among the children, and as well as school activities. So it has to be at the family level as well as in the school level. School, they should not be able selling the junk food or again the sodas and all. And at a higher level, or the national or the political level, policies can be made as to curtail the advertisements of selling these advertisements with sugary drinks and all the junk food. They may also eventually bring down the childhood obesity.
We will move on. Next question, that is, what are the consequences of obesity?
I already mentioned that obesity, because of that, it's a metabolic syndrome which causes it's an abnormal metabolism of the fats, as well as there are a certain hormones called leptins, and so there is an abnormal metabolism of this, and this gives rise to a deranged appetite and satiety cycle. Basically, it means that the more the fatter you are, or the more obese you are, then it's less likely that you will be able to suppress your appetite. So this needs to be held at a check. So once a person grows more obese, then it releases all the different kinds of syndromes associated, like dyslipidemia. Then that means we are abnormally high lipids in the blood, then which gives rise to clogged arteries in the heart as well as in the brain, and vessels in the blood vessels, that is the arteries or veins of the lower and the upper limbs, resulting in blood clots and then death of the tissue. Right, and as well as it can give rise to problems with the breathing, and then knee pains, resulting in osteoarthritis, and as well as cancers. So cancers, colorectal cancers and breast cancers, even thyroid cancers are known to occur with obesity.
Can you please tell our viewers what is considered severe obesity?
Severe obesity is, as I said, the body mass index, which is actually the measure of the weight with respect to one's height. So once the weight, this particular ratio increases beyond 30, then it is called obesity. So if it is more than 35 or 40, then it is severe obesity. So this brings with it again remarkably different set of diseases, and these are more difficult to treat.
We have next question. How do obese people lose fat?
What does it exactly mean?
Just our viewer asked,
what are the ways in which they can lose weight?
Yes.
Okay. Yeah, again, there is a problem. Actually, rather than asking it this way, how effective is the weight loss, the non-surgical or the non-medical weight loss versus the medical ways of weight loss, especially in very obese, morbidly obese. So the problem with them is, once they become very obese, it's not impossible for them to work out. Even walking a few meters will give them very painful knees, and as well as breathlessness, and they will have extreme exhaustion. So there's no way in which they can lose weight by the way of exercise, or their diet they can still control, but cravings they will have, they'll end up snacking. They may have they may diet during the time of the dieting, but in between they can snack. So these are the problems. So in severe or morbidly obese, it has been shown scientifically and as well as through various research papers that bariatric surgery, yes, offers a long-lasting cure and effects a good weight loss in morbidly obese.
So can you please suggest few weight management strategies and solution for obesity?
Yeah, right. I wouldn't suggest anybody to outrightly go to bariatric surgery. They have to exhaust every means of losing weight with non-surgical or non-medical means by ways of exercise and diet, and which has to be done consistently and over a prolonged period of time. Unless they do this, it's very difficult to lose weight, and many of the times what we see is they will lose weight. It is very you suppress your calories, you reduce the calorie intake for a prolonged period of time, then you lose weight, but then the moment you stop, you'll regain the weight. So that is the problem. So there are various diets, like very low calorie diets, VLCDs. So these are available, but the problem with that is they can cause very severe hunger in between. So people will be like, say you have given the dietitian or the nutritionist has put them on a very low calorie diet for a month or so. So they will follow it for a month, and the moment they stop with the diet, next they'll start binging on it and they'll return back to their original weight. So that is the problem. And next is exercise. So exercise, as I said, it requires at least 40 minutes of exercise. But these two, yes, unless you are very highly motivated, it is very difficult. And a lot of people, they regain their weight back, and once they regain their weight back, they lose their morale, and then they'll just they'll resign to their fate that yes, they were destined to be obese and they were destined to be fat, which is not at all so. So then for such people who have tried all the methods and means to lose weight and still haven't lost, or if they have all the multiple diseases like diabetes or hypertension or the breathing difficulties and all, these are the people who are best treated with bariatric surgery, right? So bariatric surgery, if I have to tell you briefly, it is a strategy where the stomach, which is actually a sac in the abdomen, the entire thing is not stomach, actually it's an organ within the abdomen, so which is actually reduced in size. So this results, this has a twofold advantage. One is to reduce the quantity of food that one is capable of ingesting or eating. So as soon as a person eats a little food, they will feel full. So that is one sign which their brain says, okay, right, I am not supposed to eat anymore. That is one. And number two, there's another hormone called ghrelin, and once we remove the stomach, that hormone is not produced. This is the one which perpetuates eating. So that is also, so there's a twofold advantage. So this way, and there is another means where we join the stomach to the intestine, and see some of the absorption of some nutrients may also reduce. So that way we can give up to 50 to 70% weight loss, and this is sustained even to more than 5 years. And one more thing is, bariatric surgery has also shown that it at least rises the life expectancy to 5 years.
Thank you, sir. With this, we come to the end of today's live show. Thank you for joining us.